Remember him saying furloughing government employees.
Yeah. So, I mean, that was kind of, I thought, creative. You know what I mean? When you talk about taking advantage of this federal money, that's pretty creative.
Mm-hmm.
Get them on the PUA. Save our local funds. 916. Anyway, good morning. This is the link on the breeze. It's multimedia. We're everywhere. We're on Facebook Live. We do KUM TV the first half of the show. We're on the breeze, the radio station. 917. Let's go to the Zoom room where we have the medical director for the Guam Memorial Hospital, Dr. Annie Bordallo, and is he the chief financial guy, William Kando? Sorry, William, I forgot your title.
He does it all over there.
He does.
Yeah.
Normally I'm the associate administrator of operations, but since Lillian is on a leave of absence, I'm the acting hospital administrator.
There you go. It's like volleyball. Everyone move up a little bit. Is Lillian doing good? Is she okay?
Oh yeah.
Okay.
Did she go to Taiwan?
I know she went to
From the-
Taiwan at
the-
first. I don't know why. Or
Is she on island?
She is off island,
Okay.
and to maintain HIPAA compliance, that's all I'm going to say.
Okay.
So there you go. It's a medical thing. 918. I guess we'll start with Dr. Bordallo. Good morning first, Doc. What do you have to report from the Guam Memorial Hospital?
Good morning. William has all the statistics.
Okay.
We're doing quite well. I think our COVID numbers are still maintaining a low level, and we're continuing to catch up on our second doses of vaccinating not only our staff, but our staff's elderly family members, and then some government of Guam agencies who we help to give their first doses are coming in as well. So we're quite busy this morning as everybody's showing up, which is good. The more people that get vaccinated, the better for us. That means hopefully we keep them out of our hospital.
Right. So what's the COVID census, William?
COVID census as of this morning is 7. 5 of them are in Care 4. There's actually a total of 6, but one of them is a medical PUI, so that's not really a COVID patient. It's just a person under investigation or of interest. In our ICU, we have 2, and one is on vent. So we have a total of 7 COVID positives inpatients in the house.
7, including the one who's a PUI.
7 does not. We don't include the PUI as
okay.
a COVID.
Okay. Okay, so you mentioned 6, so that's what I was.
Right.
Yeah. So 5 COVIDs in Care 4 and 2 in Care 5.
Is that ICU level of care?
Yeah, we have 2
and-
level. We have 2 ICU level of care.
Okay.
But we have lots of ICU patients,
Mm-hmm.
more than our usual of non-COVID. So again, the ICU is still quite busy, not with COVID patients, but with non-COVID patients.
Mm-hmm.
Has that kind of been a trend as
We have a total of 11 ICU patients. And so aside from the 2 COVIDs, the rest of those 11 are non-COVID. And then the non-COVID, we have 4 of them. 4 of them are on vents, and there's 1 ICU PUI that's also on vent.
What's the status of the skilled nursing unit?
Skilled nursing unit is still at the Catholic Social Services, and we have 7 residents over there, and so they're still there.
Right. I think the last time we spoke, we were waiting on the plans or the renovations to start or repairs.
That's correct. That's correct. At our skilled nursing facility, we are still in the design phase to isolate the B wing. That would make the facility much more flexible to bring the SNF residents back, and so that we wouldn't have to worry about whether we're going to have another surge or not. That we would be able, if we did have another surge, we would be able to protect them. Mm-hmm. So we're heading towards a final design for that isolation of the B wing. The good news is, as of this morning, we had a conference Zoom with FEMA, and so they approved the scope of work that we're designing for the isolation of that B wing to be a part of the larger alternate care facility grant. So that will be funded as well under this FEMA grant program.
Mm-hmm. How much money is this grant worth?
The grant, the overall price tag of the grant is $15 million. Mm-hmm. And so there's different aspects of that grant. There's design, there's construction, there's medical equipment, and so yeah, it's going to be a big success story for Guam and for GMHA, especially as it pertains to emergency preparedness going forward.
Right. I'm sorry. Can you refresh my memory about this alternate care facility?
Yeah. So besides designing for the isolation of the B wing, the larger development of the skilled nursing facility into a switch-ready facility that will be more ready in the future to respond to something of the magnitude that we're going through right now with COVID. So we're looking at things, additional HVAC upgrade, a new chiller would be involved. We're looking at negative pressure in all the rooms, just various aspects that will, allow us to do, even up to ICU level of care, possibly temporarily, prior to, the real ICU level of care obviously is going to be done here at the hospital. It's always going to be here at the hospital, but at least you'll be able to do you'll have more of a capability to perform that also at that skilled nursing facility.
Mm-hmm.
Yeah, Sabrina, the federal government, as part of our response to an acute care pandemic. So I think what's different is a lot of these patients who came in sick with COVID requiring hospitalization really required high level care. They had to be on cardiac monitors, on oxygen monitors. So it's a little bit different than just housing large numbers of people who need low level care. Mm-hmm. So the alternate care facility up at the SNF can house 40, 50 beds, but it wasn't designed to be an acute care facility. And because these patients really required higher level care, that's where this conversion is. That $15 million is going to equipment, beds, monitors, so that if we needed more acute care beds over and above what GMH and GRMC could provide, our next acute care place would be in the SNF building and not the mobile hospital that, let's say, the military could provide.
Right.
So that's where this $15 million is largely going.
Mm-hmm. But we even have the staff, I guess, to work in the SNF or the alternate care facility once it's stood up?
Well, again, we would stand it up much like we stood up this surge. We have to bring staff in. Mm-hmm. We don't have enough staff for the existing rooms. I mean, there's lots of expansion capability of beds, both at GMH and at GRMC. Remember, GRMC, I think, has 120 beds, and their normal census is between 80 and 90 patients. That's all they can staff for. Our capacity at GMH is somewhere in the 150, we can surge up to 200, even 240 beds, but we only have staff really for 120. That's our average census. So, normal staff and critical staff is different. So, when we're in the crisis mode, our staff stretches. So that 250 beds, yeah, we as much as we would need more staff, we won't have it. So they remain in our facility so we can eyeball them. That's the challenge always. But if we don't have beds that can adequately care for the patients, then, sometimes I don't know whether they just should stay home.
Mm-hmm.
But this is our response. And that for sure, we have recruiting agencies right now. That was a big part of our expense, let's say in the September through November surge, was we had to get, 80 nurses to be flown in here, just to accommodate those patients.
The important thing too to remember about the skilled nursing facility is it's a hardened facility. I mean, so you don't want to be putting acute care patients, if you don't have to, in tents in field hospitals. That would be like a last resort. It's always better to have them in a hardened facility that is typhoon prepared. And so even FEMA and HHS is, they will tell you that, hey, where are your hardened facilities? These are the facilities we want to see and develop Guam's alternate care site plan overall for the entire island.
Right. No, and I guess, it really is a good thing. So we don't have, we're not confronted with what we were confronted with in the beginning of this pandemic, and during the surge, where we were needing nurses, we were needing space, we were needing hospital beds. So what about the Guam Memorial Hospital board? Are they meeting tonight?
They are meeting
Yeah.
tonight. We'll be meeting starting at 5 o'clock tonight.
Mm-hmm.
But the first part of the meeting is executive session.
Why executive session?
We go
Is that
into executive session when we need to discuss, legal matters that where we need to maintain confidentiality on such legal matters.
So what else is on the agenda for today?
Aside from the executive session, it's the usual, standing reports of all the different subcommittees, as well as the administrator's report. So as far as the subcommittees, we get into facility CIPIT, we get into quality and safety subcommittee, and talk about the what was the safety, quality and safety issues that we addressed during that meeting, where we were reviewing our QAPI program, quality assurance and performance improvement. We have a subcommittee on governance, strategic planning, and bylaws. So we just and then we have one for finance. So we're looking at those issues. We're looking at we always have to update the board on our finances, because they carry the fiduciary responsibility for the hospital as far as these issues. And so by keeping them informed, they're able to help inform our decisions as well, and because they have a very important leadership role to play for us.
Mm-hmm.
William, when you talked about executive session, legal matters, is there like a lawsuit that we need to know about, or is this just routine stuff?
Not that I would share during this session.
So yes, okay.
Like as in a new lawsuit or recently filed lawsuit?
Could be.
Blink twice if it's a recently filed lawsuit.
Mm-hmm. I had gone through the minutes from, I want to say maybe about a couple months ago from the GMH board meeting, and there was reference to a lawsuit regarding double pay. Oh, is that? Are you aware if there's any?
No, I'm not.
regarding
I'm
double
not.
pay?
I'm not aware of any double pay lawsuit for GMH.
Have you seen any of the bills that have been introduced recently? I know we had Speaker Terlahi on, and there was a bill that she just introduced regarding differential pay for nurses. Have you had a chance to review that?
No, I have not. I know she was inviting us to a hearing relative to the nursing compact, and that we're probably going to be zooming in on. But no, I'm not familiar with the other one.
Dr. Bordallo, is there, when we talked to Dr. Ann back during the second surge, and just other doctors, they talked about how the people who were getting the COVID at that time were getting really sick, obviously, right, as we saw those deaths. How would you describe the level of illness that we're seeing with the patients who are being hospitalized with the coronavirus at GMH?
Well, I think a lot of the patients, certainly the ICU patients, this is a long illness. I think that's one is they get very sick. The other is they stay for months, a month or two. So once they cross into that critical level, it takes quite a while for them to heal. So some of these patients in the ICU have been there for quite a while. It's part of that second surge. We're very conservative about opening our rooms back up and rearranging because of the holidays. We're now in peak or 2. So we want to see what happens in the next 2 to 3 weeks as people start to move around. Again, we're expecting more people, but honestly, the numbers have been quite low. I monitor everybody who comes into the emergency room on a daily basis, and they test everybody, and we've had very few. We see about 35 patients a day at the hospital in the emergency room and urgent care, and very few of them recently, I would say in the last month, it may be one patient who's testing positive, 1 to 2 patients on a daily basis. So, and they're not even getting admitted. So I think, the keeping travelers quarantine plays a big role in that. I think everybody's heard about these variants going around. We don't have the capacity here to test for variants because these are sort of genetic sequencing type of tests that they're done at really high level labs. And we know it's around. So again, the fact that we've kind of shut down our travelers now going on several months and really quarantine helps to control that. So I think opening up the community is a good idea because we know locally there are very few cases. They tend to be in small clusters that they're picking up on contact tracing, but it's really when we bring a lot of people in from the outside that it becomes, those are the things again that we think about all the time, how to prepare for that. And again, now that we're starting to vaccinate everybody and really trying to get more access. I know public health has opened some large clinics now. We vaccinated over 3,500 people in our hospital just when we count our employees. We vaccinated almost 1,000 employees, and we vaccinated another 2,500 other, and a lot of them are our employees' parents and grandparents, any siblings that were over 60. And then we also supported the government of Guam agencies that are frontliners, like law enforcement, people who are front-facing. So I think the more we get those vaccinations into people's arms and get more access to them, I think then we feel a little bit more protected. But we don't know that. It's going to be a few months before we know how well protected we are, because it will be, the numbers will stay down and will just be travelers and not local community members. But the faster we can get it to people like you, Chris, and Sabrina, who don't meet the age criteria, and again, you're front facing, but because Zoom is so great, you're really front facing from maybe the comfort of your studio or from your, as me, I'm in my living room right now.
Well, we do have reporters and photographers that are out at the vaccination clinics, that are out, at the crime scenes, that are out.
For sure, for sure. And I think the more that they're available, I think we're just waiting for another supply. As soon as we get that third allotment, we're going to have a better idea of how we can open that up more and more.
Well, because we're seeing we're seeing lower numbers of positive cases and lower numbers of hospitalizations. Are you guys not really using those antibody treatments anymore? The Bamlani V.
The Bemivibab. There's criteria for using them, and unfortunately, they're not really hospital patients. So that's one of these are medications that should be available now to the clinics, because that's where they're going to identify these positives that don't need to be hospitalized, but might meet the criteria. And I know GRMC has a referral clinic that if somebody from the, let's say, other clinics identify a candidate, they send them there for the outpatient. But the usage is low because our numbers have been low, but it does remain a weapon in our, severe illness, but again, having it, unfortunately, the problem with the government is when they're not really available outside at the pharmacies. You have to come, so we lend it to them, or we give it to where they're, but the use at the moment is quite low, just because, again, we don't have that many people meeting the criteria.
Well, as we plan ahead and we look at this alternate care facility, where are we with, I guess, plans and for a new hospital?
I know the task force that the governor has, the governor's office has put together. They're gearing up to start meeting. It was really, this whole process was really interrupted by COVID. COVID really became, the whole event for us, for Guam. Nothing took precedence over it, and so that whole effort really had to be delayed. But I know that they're getting their contact numbers, names together again, and starting to email and to prepare to start having those first meetings.
Okay. All right. I
think our priority right now is to get our community vaccinated, and that's the federal government priority at the moment. So we should start to see, hopefully, more vaccines coming in so that we can expand that. I think that's our top priority. The more people we get vaccinated, we're going to feel a lot more comfortable.
All right. Do you have anything else, Chris?
Well, just on that note, I wanted to share from Dr. When they're doing they're doing the Gdoe vaccination outreach, so they're completely full on the registration for tonight's immunization for Gdoe at Tejan High School gym. They'll open some slots for walk-in, just reminding people who have registered to show up 15 to 20 minutes prior to their appointment time. A few appointments are still available for tomorrow. You can sign up online via the Gdoe email sent out by the schools. So.
All right. Was there any final comments, William?
I just want to encourage people not to give up the opportunity. So if you meet any of those criteria, if you're 60 and over, there are as much as you think there are going to be long lines and big crowds, they have really good process now to get people moving through. It might look crowded on the outside, but it flows quite well. And so I would encourage, and I know the UOG's clinic has 15 walk-ins per hour on top of the, I believe, 75 that are eligible to make appointments. So if you are in any of those categories, I would really encourage you not to assume there's going to be a long line or it's going to be really hard to get. I think the flow of these vaccination clinics in our facility, if you come at 8 in the morning, you're going to see 50 or 60 people sitting in the lobby, but an hour later, there's 0 people. Just because once it opens and gets flowing, it's quite quick. So I think, I know a lot of people after the Gdoe long lines sort of feel like, oh, I don't want to go, I don't want to take the time to do that. But I would encourage people to go and take advantage of those clinics because they really are flowing a lot better and they have a lot more experience now. So things are moving, I think, a lot more efficiently.
And just to follow up on what Dr. Bordallo was mentioning, there is another vaccination clinic. It is at the University of Guam, Calvo Field House. That's from 2 to 8 p.m. You need to register on Eventbrite, and that's for the first and second dose of the Pfizer vaccine. So there's 85 slots that are available per day through Saturday. So thank you,
and Sabrina. I think that's 85 per hour.
Yes, I'm sorry. Available hourly.
Yes,
per day.
I think there's a lot of capacity, a lot more capacity than we think. I think they had 1,400 people sign up already for the week. But again, that's still not, a lot of that was on one day. So there's still some capacity. So I would encourage people to walk in because again, they're taking 15 walk-ins an hour. If they can't take you that hour, you go shop at Payless and come back and you're probably going to be able to get in. So the importance of getting that vaccine, especially if you're in this older crowd, is so high that it's worth, I mean, I see people at Ross line up at 6 in the morning, a very long line. So, for something as important as this, just, really take advantage. And I know the Southern Clinic is open as well as the Northern Clinic. So there are availability in a lot more availability. So we encourage people to take their parents, encourage them to get out there if they meet those criteria.
All right, there you go. Join the vaccination. Dr. Bordallo, just on a side note, have you seen a baby boom by any chance? I've been wanting to.
Does anybody name their kid COVID?
You know how we love babies, right? We love the pregnancy thing. We love the baby. We love telling stories about that. So like the typhoon, people ask me, well, does the barometric pressure make more people? I said, no, the anxiety that their house is going to be blown down gives them more contractions, but it doesn't necessarily make them deliver. And when we've looked at those super typhoons, it's 10 months later that they have a boom. We're not any more or less busy, but I think, again, if those of you that are trapped in the house with little kids and your spouse, making a baby isn't really up there on the, you're lucky to survive actually going into the same room. Everybody's spread out because it's stressful to be cooped up for this long, and many of our young people are, their jobs are restricted. So I haven't seen an increase in the numbers in terms of the babies. And what is it, March? So that we'll be talking about December, January. So I don't know. We'll see what happens in maybe 3 months from now, where people were kind of getting a little bit more used to it. I think they were quite scared, and so I'm not sure that's really.
Well, sometimes being scared gets you worked up, Doc.
Well, I don't know, Chris. We'll see. We'll see if you're going to.
All right. Okay. We'll see you, William. Thank you,
Thank you.
Doctor. And
Thank you.
great having you on. Come back. We'll see you
Okay,
guys.
have a good.
You too.
Stay safe.
Yeah. So sounds like there's a new lawsuit